All right, these guys are going to show us how the lab draw process works here. All right, go ahead.
All right, so
what equipment do you need?
So we need a straight needle, our tube that we're going to be drawing our specimen in. We're doing a creatinine, so we'll be doing it in a green lithium tube.
Okay.
Our tourniquet, alcohol, piece of 2x2 gauze, and Copan.
Perfect.
So, all right. First process, you identify your patient and everything. So, sir, what is your name and your birthday?
Name and date of birth.
And why would you choose a straight needle over one of the butterfly options?
So we usually like to go kind of up, in the bend of the arm. That's the best veins to go for. You're gonna get your best sample, and the straight needles are a little bit bigger diameter, bigger gauge needle, so you're gonna get better blood flow. It's gonna cut down on the rate of hemolysis and clotting.
Okay.
Give you the best sample. So first thing, you're just gonna wanna put your tourniquet on.
So I am going to point out while he's doing that, your draw order of your tubes actually prints out in order on the labels. So if you just follow the top down, you'll see what colors you need to draw in what order. It also says which labs are ordered for each tube. Okay.
Right. So I found my spot where I want to go. I'm going to go right here. So basically I'm just going to get my alcohol swab ready. I'm going to start in the middle of the area where I'm going to poke and kind of work my way outward, kind of clean it in a circular motion.
And we don't want them to pump their hand, right?
No.
Okay.
Nope. And then we'll kind of let that air dry. You don't want to poke right away because the alcohol can give false results and everything like that. So let the air dry. You don't want to pad it with the gauze or anything like that.
Okay.
So just kind of let it air dry for a second.
And not touching it is especially important for like blood cultures after you've cleansed it. So you don't want to touch it after you've cleansed it.
Nope. And then if you do have to touch it, then you need to re-clean the site again.
Okay.
So, but now we get some time. So basically, what you're going to do is you have your straight needle. You're going to remove your safety like this. Pop this off. And then what I do is I go kind of 2-3 fingers lower than where I'm going to poke. And you want your needle kind of about 30 degrees parallel with the arm. And you're just going to kind of poke right in the vein. You don't want to go too far in. You just want to get kind of basically the tip of the bevel in there. And then kind of hold firm. Pop that tube in. Use your other hand and your thumb. And just push the tube on. You can see it filling up. As it fills up, I kind of rotate the tube a little bit.
Okay. So then you would pull out the tube and draw them in order of the colors that printed out on the label. And the blue tubes they have to be filled all the way to the minimum fill line. There's no exceptions on the blue tubes. The other tubes you can get away with half capacity if you have to. It really depends on how many tests are ordered on that color of tube. So just look at your labels to find that out. If you're doing a lactate, you would want to pop the tourniquet before you draw that last tube there.
Yep. And then so I filled the tube. So now, before I take the needle out, you'll pop the tourniquet. Take your 2x2. And what I do is I kind of cover the site, but I don't push down right away. I'll take the needle out. Then I'll push. Kind of keep the needle away from you and push that down until you hear the click, and that's you putting your safety on. And then from there, you'll just wrap the patient's arm up, and then once you get to this step, you want to discard your sharps, kind of invert your tubes. Every tube you need to be inverting about 5 to 10 times.
Okay. So every tube invert probably 7 to 10 times each.
Yep.
Don't shake it hard, just inverting gently like you see him doing. And then if you are drawing a type and screen, then we would use a blue band to put on the patient, label it, and verify their name and birth date, and then put the extra blue band stickers in the pocket in the front of the bio bag. So he's going to show us how he labels the tubes.
So I'll just take the label, and the way you want to label is you want, how you have this label, you want the test kind of how there's this gap. You want the test towards the top of the tube, and then you have this color strip. You actually want this visible, so when the techs go to take care of the blood and to test it, they can see what tube color that actually is, because they'll switch these caps out with a blue cap, so it's hard for them to kind of tell if it's a green tube versus a gold tube or a red tube. So we just like keeping that color strip visible then.
Awesome, that's good to know. All right, anything else you want to add for us? Or is that it? We put them in a bio bag before we transport them to lab.
Yep.
All right, thanks guys.
Welcome.